Understanding mental health has never been more important than during this lockdown period over the last 3 months. And during this time in my clinical practice, what I've seen most commonly is presentations of fear, anxiety, and the blues or sadness. Now, you'll say that these are common human reactions to our external reality. So these are normal reactions. Uh, but what we see in clinical practice is that if these reactions are not resolved and have lasted for several days on end and is starting to affect day to day life, it's starting to have significant impairments in the sleep, and it's starting to lead to irrational behavior uh, and worries, then we start to look at whether these have now turned into an anxiety disorder or depression. So most commonly what I'm seeing is that who present with blues have lasted for several days on end tend to present with clinical depression. So how do we differentiate whether the person is experiencing only the blues or depression? Well, it's quite simple. Firstly, we look for the number and nature of symptoms. So for example, someone with depression will present with a continuous depressed mood that is lasted for 2 weeks or longer. They've made efforts to feel better and they're not able to come out of it. There is associated loss of interest in previously pleasurable activities. They've lost energy and enthusiasm for things which were enjoyable. They start to have significant impairments in sleep. For example, waking up 1 or 2 hours earlier than usual. Uh, and they also frequently wake up at night. They've lost appetite and they've lost weight even when they're eating reasonably. Alongside, they'll have other impairments like difficulties in concentration and difficulties in attending to things. Most importantly, difficulties in attending to work, especially when a lot of people are working from home. So when people have that many number of symptoms and it's having significant impact on their life, then we start to think whether this is depression. Now, depression then needs to be treated, not just by giving practical advice, for example, how to manage the mood by engaging in activities which is relaxing and de-stressing, but also engaging in activity which is activating the body. For example, a regular exercise routine. Alongside of all these things, we tell people during the lockdown period as to how to come out of depression and gloom. Most commonly, we say people to reduce their exposure to negativity and negative vibrations. And in this case, it's most commonly coming from social media, from the news, and from the television network, which has been playing all the negative, catastrophic news for months on end. So we ask people to cut down the news exposure and social media exposure. In doing so, you're less likely to feel negative and pessimistic and more likely to feel better in your mood. Then we ask people to establish a good routine around their daytime, especially with the changes in workflow, to have a structured routine, not just around the work, but also around the time with leisure and family. Third, we ask people to enhance connection with family members because when you connect, you talk and you share your problems. And there's a good saying to say that a problem shared is a problem halved, which means that when you speak up, when you share your burden, then you feel unburdened and you feel lighter. For people who have done all this and not able to come out of the depressed mood, we go on to advise them to take a short course of antidepressant. Again, antidepressants are not addictive, they're safe even when taken for long periods of time, and most people do come out of their antidepressants. Therefore, if you or anybody you know might have experienced these symptoms of depression, then I suggest you seek help because early help means early resolution of problem, early recovery, and significantly reduction in suffering.